station. This is Bobo FM. The views and opinions expressed by the following program and its participants are solely their own opinions and do not represent the opinions of DMS Broadcasting and have no affiliation to the BBC.
At the Health Services Authority, we want to keep you informed about the latest developments that impact your health because your health matters to us. Join us each Friday and Saturday from 1 to 2 p.m. as we cover health news, offer advice, and answer your questions on Healthcare Today with HSA.
When you have a sports or fitness-related injury, trust the expertise of the HSA Sports and Exercise Medicine Clinic to get you back in the game. Our internationally trained and certified physicians specialize in sports traumatology, sports medicine, pain management, and orthopedic surgery. For treatment of common injuries such as tendonitis, arthritis, tennis elbow, rotator cuff, or knee tears, schedule a consultation with the Sports and Exercise Medicine Clinic at Smith Road Medical Center by calling 949-8600 or visit hsa.ky for more information.
Hello, Cayman, and welcome to another episode of Healthcare Today with the HSA. I'm your host, Austin Harris. And it is our pleasure to host today's episode where we learn again about more exciting services being provided by your Health Services Authority. That is, of course, the Cayman Islands Hospital, for those of you who may be new to the program. An exciting episode for you today. A groundbreaking, first ever of its kind in the Cayman Islands kind of episode. And with me to talk about it, it is my pleasure to welcome neurosurgeon at the HSA, Dr. Dwaine Cooke, and he is joined by nurse manager, Miss Grace Boda. Doctor and nurse, welcome to Healthcare Today.
Thank you.
Thank you for having us.
Pleasure to have both of you as our guest in studios. And whilst I seek to keep our listening audience in limbo just a little while longer, before we hit the ground running on today's topic, maybe we can tell our audiences a little bit about yourselves. I'm old-fashioned, so I'm going to do ladies first, if you don't mind. Nurse manager Grace Boda, talk to us about your clinical professional background and also, out of curiosity, how long you've been, a resident on our lovely island.
Yes, thank you, Mr. Austin. So my name is Grace Boda. I'm nurse manager for operating room at HSA Hospital. I've joined HSA in 2022, and my previous experience has been a nurse for over 29 years, predominantly in the operating room. And my passion is for neurosurgery and spine. So I'm here at Island for over 2.5 years now, and I'm enjoying leading the team in the OR at HSA, and I have a great team, and so it's really exciting that we are approaching new techniques within our theaters, especially we're going to talk more about that procedure. So we're very happy to be here and share our experience with you all.
Indeed. Thank you very much. We're very happy to have you not only on the island, providing your expertise and care to patients across the island, but in particular being our guest here on Healthcare Today. Dr. Dwaine Cooke, neurosurgeon. For a while there weren't many neurosurgeons resident in the Cayman Islands. So welcome. A pleasure to have you. Talk to us a little bit about your clinical and professional background.
Good day, everyone. My name is Dr. Dwaine Cooke. I am a neurosurgeon with training in neurosurgery in Jamaica with experiences in Canada and the USA. I've been here since early 2022, and it's been a wonderful experience working with the staff at the Health Services Authority. It's been a trek that has significantly improved over time to the point where we can offer world-class experience or services to patients. We are excited to share with everyone this particular procedure, which we'll delve into a little later. Some of the areas that I treat include brain and spine related problems that may require surgical interventions.
All right. Well, thank you very much for that. And again, on behalf of those tuning in, welcome both to the Cayman Islands, and it's terrific to have you, Dr. Cooke, and you, Nurse Boda, as part of the clinical staff at the HSA. Now, on the point of why we're gathered here today, on the 16th of October, the HSA issued a press release. I don't know how many people in the listening audience saw it, but I'm sure, like everyone else, you wait for it to come out in the media. But the health services marked a significant advancement, if you will say, in the field of neurosurgery in general, but specifically here in the Cayman Islands, marking, I believe, what was the first of its kind awake brain surgery. The notion of, first of all, brain surgery would be frightening enough. I mean, it is a critical human function controlling just about everything else. But then you add to it the, extra risk factor of being awake while someone performs surgery on your critical brain and its functions. Talk to us, Doctor,
Yes.
About this incredible leap forward, which I understand is considered the gold standard now in neurosurgery and dealing with certain types of tumors and whatnot. But what is the process involved in an awake craniotomy or brain surgery?
Right. So certainly, for our listeners out there, an awake craniotomy is basically the term that we use for describing the process of performing a neurosurgical procedure with the patient being conscious and alert and being interactive with the surrounding staff members, being able to verbalize and or perform basic functions as moving a limb. So that we can get real-time assessment of their neurological function while the process is taking place of removing a tumor or taking out a part of the brain. And this is important to do because, these particular problems, so it's a tumor, it may be in a tricky part of the brain that has important functions like moving a hand. In which case you'd want to know from the beginning where these areas are located so that you can avoid it.
Right.
So as to minimize any damage after surgery.
Right.
I mean, typically what would have happened in prior cases is that you would be doing these surgeries and with the patient remaining asleep throughout the procedure.
Yeah.
If you remove you may be successful in removing the tumor, but at the end of the procedure, the patient wakes up and you're not moving the hand.
Right.
So if you are able to anticipate where these areas are and try to avoid them, you'd know from before you even touch the tumor that you are in a safe area.
Right.
And, that's a no-go zone if you do see a problem, with that area.
I see.
So it is. It certainly has specific indications. It's not a procedure for everyone.
Okay.
And you have to carefully choose your client. You have to identify them from the beginning. Talk them through the process. Tell them what their expectations are. You have to assemble the correct team. Everyone has to be on board. And must be comfortable as well to provide the services.
Right. Now, you said a lot there.
Yes.
And I want to delve in a little bit on what you said. First of all, obviously it's surgery on the brain while the patient is awake versus the traditional model of being anesthetized and put to sleep, and then, of course, the surgery is performed. One of the benefits of it is allows the doctor or physicians to maneuver around some of the more eloquent functions of the brain, looking for perhaps removal of a tumor, but also avoiding any other key aspects.
Correct.
That's the first area I want to touch on.
Yeah.
Forgive me from a layman's perspective, but I view the brain as every part being an important part. One is speech, one is touch, one is, emotions, if you will. If the benefits derived from awake brain surgery are such that it allows the medical practitioner to go in and remove the affecting or infected area without damaging anything else, why would anybody ever go back to the alternative method where, to your point, you may fix the problem, it may be considered a success, but there is a possibility that perhaps something else may affect the patient afterwards. So why would we want anything else but the awake surgery?
Well, certainly, when you think of it, brain surgery is a long procedure. You typically looking at resection of a brain tumor that could run for as little as 4 or 5 hours to, close to a day.
Wow.
Or more.
Right.
So imagine having a patient who is basically because, for you to undergo a procedure like this, you have to be restricted to one position for most times. So it requires a lot of discipline on the part of the patient. They have to be cooperative, and pretty much it is not everyone has that discipline.
Yes.
Some persons are very anxious.
Sure.
And you try to identify whether that's present from early on, talking to them, but also, the fact that, it can be a tricky procedure to do for certain conditions. It's not necessarily an indication. There are certain things that we would want to monitor, for instance. You mentioned quite importantly that the brain has key functions. So the things that we monitor as physicians would be things like movement. So movement of the limbs, speech, very important, vision, very important. There are other sort of functions elsewhere in the brain, right? But these are the key ones that we would typically want to preserve when we're doing like a brain tumor surgery. These are the areas that are close to where a tumor would be located. If it is located in other locations, like close to the brain stem and so on, those areas, it would be even more tricky to perform awake.
I see.
Yeah.
I see. Now, in terms of patient selection,
yes,
you also mentioned that it's not one size fit all. So what type of procedures would a patient be even considered for awake brain surgery?
So certainly you're doing a craniotomy for removal of a brain tumor. That's one of the common indications. A focus in the brain, an abnormal focus in the brain that might be triggering epilepsy, seizures, right? So persons who have epilepsy, they may undergo specific workup that identifies a spot in their brain that is the cause for their seizures. And if it is close to a functional part of the brain, you as a surgeon need to know how much of that you can safely remove.
Right.
So you may actually want to keep the patient awake while doing specific tests.
Yes.
And you want to know that before you take it out. Unfortunately, the brain is a structure where once removed, you can't replace.
Right.
It doesn't grow back. So you only have one opportunity to get this right.
Right.
So in this case, we'd like to know from beginning, from before we even start taking it out, where it's safe. And there are other minor indications, like if there are blood vessel abnormalities that are located in functional parts of the brain, in which case we would also need to do this awake.
Right. I see. When the news broke and the media release came out for this procedure, it stated that it was a collaborative effort with the HSA, yourself, Nurse Boda, and I suspect the operating theater itself was a busy place. It wasn't just the two of you.
Oh,
absolutely. When we consider, well, first of all, tell us who was in the theater with you, how many doctors are performing functions, and nurses are performing functions during this procedure, and also, not least of which, talk to us about the technology at use, because certainly, patients listening or persons listening thinking, well, this is all great and he seems to know what he's talking about, but, what sort of equipment is supporting these otherwise skilled physician hands? So talk to us about what's going on in the operating theater and how many of you are involved in this this groundbreaking work.
Well, certainly, as you say quite eloquently, leading up to surgery, we have to get these patients ready, and they're assessed from as early as a clinic. where they're first seen and pretty much worked up. So they're seen in a clinic, they're evaluated and said, the decision is made that you'll need surgery. We book the patients. We usually get them to see the anesthesiologist, who is a key person in this entire loop of management for these patients. And they basically sit down with the patients, sometimes multiple sittings, so as to address their concerns and so on, to just identify whether or not this would be an ideal candidate.
Right.
And it's important to talk to patients, because what you don't want are surprises on the day, because they are going to be, most times they're in this room, they're surrounded by a bunch of strangers. So you want to build a rapport with them from day one. You want them to be comfortable with you as their managing physicians, their anesthetist, their surgeon, and basically you get them all prepared. They come in the morning of surgery, and pretty much from the first person they meet, on the corridor, you want them to feel at home. They want them to feel, because they're going to be nervous. If you've been told that you have brain surgery and you could potentially become mute, at the end of the surgery, or your face won't be moving any at all, and you're here seeing persons walking past, and you feel like, this is not where you belong.
Right.
This is the last thing you want on the person's mind.
Right.
You want them to feel comfortable. From the ambulatory care unit, which is their first place where they check in, have the nurses who make them feel comfortable. We have a wonderful staff there that get them all, worked up, changed off, and then transferred to the operating theater, where they also meet their support staff. The nurses there are wonderful, getting them comfortable, and pretty much once we get them into the operating theater, which we've been days or months leading up, weeks leading up to the surgery, we're actually making preparations. But we actually sat down as a team and basically had a meeting and discussed the roles of each personnel, what we would need, what we don't have, what we need to source, in terms of medications, in terms of special equipments. On the day, you basically don't want to any hiccups, because of course that's also sending out the wrong message to an awake patient.
Right.
The last thing you want to hear as a patient who has a surgeon in your brain is that, oh, we don't have that.
Or oops.
Or oops, exactly.
Words you don't want to hear whilst having surgery.
So we try to make the patients as comfortable as possible, get them into the operating theater. There are, a lot going on that, it flowed very smoothly that day. We, from the anesthesiologist's point of view, in terms of the required medications that we have to administer, because you want to, in this case, we did what we call a sleep awake, a sleep kind of procedure. So for the beginning parts of the surgery, they're usually anesthetized, keep them, deeply sedated for the early parts of the surgery. And then the medications is withheld and allows the patients to wake up. And that would basically allow for us to do our tests.
I see.
And then for the last third of the surgery, they're usually put back to sleep, and we close up and then finish up afterwards with the patient waking up.
All right. Well, again, thank you very much for that very comprehensive response. And certainly I'm much more informed, but there's still lots more questions to come. But we do have to pause and take our first commercial break for this episode. But there still remains a lot more healthcare today with the HSA and our guests, Dr. Dwaine Cooke and Nurse Manager Grace Boda. When we come back, not only do I want to engage Nurse Boda a bit more, we talked about, what's happening or how many people are in the operating theater, but we're going to talk about, obviously somebody's got to manage this hive of activity, and I suspect that is where Nurse Boda and her team of professionals come in. But also when we come back, so we talked about preparing the patient before the procedure takes place. I want to have a conversation about what work goes into selecting the right patient, and then how do we prepare a patient emotionally and physically important leading up to the surgery. So keep it locked. We're chatting with our guests, talking about Cayman's first ever awake brain surgery, brought to you here by Healthcare Today and the HSA, and of course your friends here at Bobo FM.
The Health Services Authority's new pharmacy is now open at the Smith Road Medical Center. The new location features a large, comfortable waiting area and ticketing system to improve the patient experience. All uncollected prescriptions and refill requests previously submitted will now be available for collection at the Smith Road Pharmacy. Request your refills online at hsa.ky via WhatsApp 925-6534 or call 244-2715. For more information about our pharmacy hours, visit hsa.ky.
And welcome back to Healthcare Today with the HSA. And if you are just joining us, our guest in studios includes Dr. Dwaine Cooke, a neurosurgeon at the Cayman Islands Health Services Authority. And he is joined by nurse manager, Miss Grace Boda. And we are talking about Cayman's first ever groundbreaking awake brain surgery. That's right, you heard me correctly. Patient was awake while someone performed brain surgery on them, and it was a total success. We want to continue talking about that procedure, what is involved in it, and of course, trying to get our listeners in the brain surgery state of mind. Picking up where we left off, Nurse Boda, we talked about obviously the difference between awake brain surgery and asleep brain surgery. We talked about, the kind of patients that would otherwise be selected for this patient, for this type of surgery. Mm-hmm. We talked about what kind of technology is utilized in the operating theater and how many doctors and clinicians and nurses make up that otherwise procedure. You're the nurse manager, so I assume that with all of this hive of activity going on in the operating theater, you're sort of the umpire there, making sure that everybody does what they do, but I don't want to put words in your mouth. Talk to us about what your responsibility as nurse manager is in a procedure like this.
Okay. Well, when Dr. Dwaine, Dr. Cooke brought this news to me, that as I mentioned, actually, I'm very passionate in neurosurgery. I've been trained in Cambridge University, United Kingdom, and we have performed many of the awake craniotomies in my experience. So when this news came to me, it was exciting, and it is a great opportunity for the Cayman Islands. So we made preparations, and it's in terms of equipment, it is not so much of a difference for the sleep and awake craniotomy, but in terms of preparation of how we're going to perform, and the planning with the anesthesia side, and also with my team itself, we sat down and we had a plan of how we're going to achieve this. So my previous experience helped me a lot and supported in terms of preparation. So I had my team in the theaters, like I have circulating and scrub nurse and surgeon and surgeon assistants and 2 anesthesiologists in the theater. So we have, of course, for any surgery, we check our equipment in hand before, you don't want any surprises while the surgery is taking place. It's the same, actually. For any surgery, we make our preparations, make sure that you have everything in the theater and, you're not really running around and, looking for, and especially for this procedure, you need to have that. You want to minimize the movement in the theater because the patient may get anxious about like a lot of movement in the theater and all of that. So it was nicely planned, and we didn't actually had any untowards issues within the theater. And actually, the patient actually selected the music that she wanted to be played, and actually she was actually dancing and for that music. Actually, she
had her surgical playlist.
Yeah,
really? Wow.
From Japanese hit list, something that she chose, and so it was really like so. the planning is really important because especially when we initiate, first case for us. But I must say that everyone did their role, and we successfully completed the procedure, and this is very important for our local healthcare because. I don't know how this was approached before. These patients might have been shifted to internationally to have these procedures done before, but I just wanted to mention that we could do it locally, these procedures now, and I just wanted to feel, that we can actually achieve these cases here locally.
Yes.
So it is, and also. The complications for these cases are minimum. I know Dr. Dwaine is going to talk more about the complications, but it's a faster recovery for patients, which I have noticed previously with my experience. But I think that is one thing that we need to be looking at, because it's faster recovery, and financially that you are not actually spending, because you're not traveling outside Cayman Islands, so it's available here. So, and I'm so excited that we were able to do it, and my team has been great, and so with everyone's support actually, so we managed to do this procedure.
Indeed. Well, again, we're grateful for you and your team that you were here and able to have this procedure performed here. And certainly to answer your question, I think in the absence of your arrival, your team's arrival in the Cayman Islands, there's only, to my knowledge, there's only one other neurosurgeon who first came to the island a few years ago. I know him personally. But in those discussions that I've had with him, largely any brain surgery prior to his arrival or your arrival would definitely be an overseas visit. And that brings me to the question, whilst I'm delighted to see the HSA and the healthcare community in the Cayman Islands starting to expand their list of medical offerings, neurosurgery is such that, I guess it's like everything else. You have to do a number of them in order to maintain your efficiency and your ability, not to mention your own clinical standards. What is it like being a neurosurgeon in the Cayman Islands? Are there a lot of people lined up around the corner to have brain surgery, or is there enough volume, really, to maintain professionals such as yourselves?
Well, certainly, upon arrival here, just under 3 years ago, one thing I noticed, particularly with the HSA, is that there is a high demand for neurosurgical treatment.
Okay.
And prior to me coming here, yes, they would have relied more on the private offerings, whether it be local or overseas, and but now, as a result of that, most patients would have been used to having that option. They want to go overseas. They want to be referred out. And for many persons, they believe that there wasn't a whole lot to offer for neurosurgery. Since they weren't being treated locally, it seemed as if the numbers wasn't all that high. But certainly, there is a significant high demand for neurosurgical management here. There are lots of patients. We try our best to accommodate, as much as we can. And certainly it's certainly helping to build confidence in patients when they see and know someone who has had treatment by the neurosurgeon, whether it be brain or spine problems. And it's certainly meaning that we're keeping a lot more persons locally. And a lot of them actually, that's their preferred choice.
Right.
They have family here. It doesn't require them to travel, and pretty much they can see, they can recover or rehabilitate at home, where it's easier for them than having to travel to the States or elsewhere, where they're in a foreign land with not much, backup support.
Right, indeed. Now, Nurse Boda mentioned something rather curious. She mentioned that, in preparing the room and also preparing the patient came with their own audio surgery playlist. Now, in your opening, you talked about, a patient has to sit in a certain position. We want them to be still. But yet they bring a playlist. And I read the press release. It talked about tapping of feet. And, I assume there was, a degree of swaying or something, reaction to our own personal playlist. But talk to us about the benefits of creating that kind of environment. How does it help the procedure itself?
Well, certainly, yes. I mean, we're talking about removing a brain tumor. In this case, we're talking, your concern would be about language preservation.
Mm-hmm.
So the patient, we want the patient during the awake portion of the procedure to be able to verbalize to us. So there are going to be certain things that we will ask for them to identify. So we'd hold up pictures with objects, and they're able to talk back to us, and we compare it to before and after to see if there's any hitches or any problems with them identifying, because language is a complex process. Your ability to receive the information, process it, and then respond appropriately.
Yes.
So in this case, having the persons do those tests, but also, it goes even deeper when they're able to tell you what they want to hear.
Right.
It means that their memory is preserved. They are able to appropriately give you a response, and it helps us as the surgeon, because it gives us confidence in saying, okay, we're going in the right direction.
Right.
Right.
Gotcha. Now, curious. We talk about the difference between awake brain surgery and obviously being asleep. This procedure involves the patient being awake, but awake does not mean not sedated. You're slicing into their head, so obviously you don't want them to feel that. So there's a, what do you call it, topical or what's the clinical term for when you isolate a certain area, you sort of inject.
Anesthetize.
You're right. Okay.
Yeah.
So how do you balance that? Because on the one hand, you're managing pain.
Right.
Slicing someone's head open, that's going to cause some pain. But you administer local, that's what it is, local anesthesia.
Right.
But at the same token, you want this patient to be awake. They've got their playlist, so they're, jamming whilst you're doing your work. But they're also responding to you so as for you to ensure that, you're not hitting any key critical other areas other than what you came to do. Yeah. How do you balance that very delicate, relationship?
Yeah, so certainly, we had discussed previously that this procedure, an awake craniotomy, can be done with the patient either fully awake or sedated, awake, and sedated. So so either option requires you to do a proper scalp block.
Okay.
Where you basically target the skin nerves that's going to the scalp. Right? The brain itself doesn't have any pain fibers.
Oh.
So
okay.
So you target the scalp, the skin over the bone, and the bone itself doesn't have any pain fibers in it as well.
Okay.
So you can do a very good scalp block, and you combine that with some pain medications. So if you want to add in some sedation, that portion of the surgery when you're doing the opening the skull and so on usually can be combined with some sedation.
Yes.
And we usually use medications that wear off very quickly, meaning as soon as we stop it, within minutes, patients usually wide awake and able to converse.
Right.
And in this case, we were able to perform all of that smoothly. Initial portion, scalp block, combined with some medications to make them calm while the scalp block is being performed. I mean, it's almost like if you've ever done a dental procedure and they're doing the injections in the gum, you're going to feel discomfort.
Yeah.
While that is happening, we usually give them some form of sedation
so
as to make them calm.
Right.
We wake them up to test it, make sure it's fine, and then we perform that initial portion of the surgery.
I need you at my next dental appointment. Oh my God! If there's a doctor on the planet that scares me to the point of I just won't come in today, it's the dentist. We do need to pause and take another short commercial break. But when we come back, this procedure was a huge success in the Cayman Islands. And when we come back, we want to talk about what that means for us here in the Cayman Islands, awake brain surgery here in the Cayman Islands, what that means for the medical professionals who performed this groundbreaking work. You're listening to Healthcare Today with the HSA and our guests, Dr. Dwaine Cooke, neurosurgeon, and nurse manager Grace Boda at the Health Services Authority. And we're talking about Cayman's first ever awake brain surgery, what it involved, and when we come back, what is next, right here only on Bobo FM.
When you have a sports or fitness-related injury, trust the expertise of the HSA Sports and Exercise Medicine Clinic to get you back in the game. Our internationally trained and certified physicians specialize in sports traumatology, sports medicine, pain management, and orthopedic surgery. For treatment of common injuries such as tendonitis, arthritis, tennis elbow, rotator cuff, or knee tears, schedule a consultation with the Sports and Exercise Medicine Clinic at Smith Road Medical Center by calling 949-8600 or visit hsa.ky for more information.
And welcome back, Cayman, to more Healthcare Today with the HSA. I'm your host, Austin Harris, and having a delightful conversation on today's episode with neurosurgeon Dr. Dwaine Cooke and nurse manager Grace Boda, talking about Cayman's first ever awake brain surgery. That's right, the patient was awake, listening to her favorite music, tapping her feet, and conversing with the medical team whilst the procedure was being conducted, which, as we understood from the press release, it was a resounding success. Before even talking about what comes next, let's talk about the success, from your opinion, Dr. Cooke, on the procedure itself. We talked about, brain surgeries lasting a few hours to an entire day. How long did this procedure last? And from a medical professional's point of view, how do you feel about it at the, coming through the other side of it?
I mean, certainly, doing these procedures, it really is, it's helpful for me as a neurosurgeon to know that, you've been trained all this time to do these procedures, and you're in the Cayman Islands where you're hoping that you can provide the service to the population.
Right.
I mean, it certainly is, if you were to, initially when I had the discussion with the patient, they were, one of the first questions that they ask is, can this really be done here? So, as a neurosurgeon, you want to, I'm no more confident to answer, yes, we've done it. And yes, it has been a success. Right. And it certainly is good that we can share this with everyone to know that, we certainly can manage this and more.
Right.
And certainly it is good to know that you have the support staff and the administration that supports you and provide whatever is necessary to make it work.
Yes, indeed. Nurse Boda, similar question, but from your own personal perspective, that of yourself and the team. Again, this is not ballpark surgery. This is severely, highly complex surgery on a key critical component in the human anatomy.
That's right.
But you pulled it off. What does that do for your own personal morale, but also likewise that of your team?
Okay. So as we know that this is a milestone for my team and for the organization and to the Cayman Islands itself. So this certainly led to the training and education for my team, and with the consecutive cases that is going to approach, and also it actually improve. It boosts the confidence in my team that hey, we can do this groundbreaking procedures here at HSA. So that led to the perception that actually we need to be and thanks to the patient actually for giving us this opportunity for us
Sure.
to be, taking this approach, and which actually for my team, and it's a collaborative work with all the specialty like surgeons, anesthetists, and support team, pharmacy, and and post-operative surgical ward, and so it's a collaborative work. So it all actually boosted the confidence that we could actually do these procedures here at HSA. And in future we'll be looking at not just me as a team leading, but any of my team could actually take this case and support and assist the case.
Right.
Right. So this is a great opportunity for us, and for me personally, having done those cases, and so coming with that experience here, it actually boosts my morale as well to support my team with that experience.
Indeed.
Yeah.
And I'm glad you thanked the patient. I mean, I've sort of purposely avoided discussing the patient because that involves, discussing what was broken, what was working, and whatnot. And, people are kind of skittish about that. But when we say the operation, the procedure was a success, how is the patient doing?
Fabulous.
Yeah?
Yeah. Appreciative, and pretty much, have recovered fully.
Okay.
And basically, as the word that was shared before, it was a success.
Was a success.
Yeah.
And what is her post-surgery recovery, procedure, or not procedure, but, obviously she's got to follow certain rules, I guess. I mean, what does her post-surgery recovery look like for her?
Right. I mean, after these procedures, the recovery is pretty much standard thereafter in terms of whether you did an asleep craniotomy versus an awake craniotomy. You
Right.
go into the critical care or intensive care unit where you're monitored closely because you have to monitor for potential complications.
Yes.
And you get rehabilitated in terms of getting help from the physiotherapist to get you mobile, walking. And once that phase is finished, you go home, continue your recovery. And recovery doesn't mean lying in bed.
Right.
Usually means, you still have to, get up, walk around, get some exercise in terms of around the house. Nothing too strenuous.
Yeah.
But not too much stimulations. The brain has undergone surgery. You're gonna feel a little exhausted.
Sure.
Probably some of the medications that you take for pain, it would make you a little groggy and so on. So you're not gonna be wandering around too much. Not too much in terms of you're gonna be off from any major input from outside in terms of work or non-work at home. Try to take it easy. And within, after surgery like this, we usually say 6 to 12 weeks worth of recovery before venturing back out to normal lifestyle.
Right. Now, again, just thinking, whilst we've already predetermined it was a success, the patient feedback is a success, but every case is different. What are some of the potential risk factors associated with brain surgery, or in this case particularly awake brain surgery? Things like, I guess, bleeding, swelling, infections. In your experience, again, sort of to be completely transparent to our listening audience, whilst it was a success, we've got the right team, we've got the right equipment, we've got the right environment. We've taken the necessary precautions, we've followed our playbook exactly, and it resulted in a success for everyone involved. Praise God, we're excited about that. But let's talk about what are some of the risks that could happen with this type of surgery, and any type of surgery, really.
Right. So, I mean, certainly whenever you're talking about an awake brain surgery, you're talking about specifically a tumor or a lesion in a very eloquent part of the brain. And by eloquent, we mean a functional part of the brain. And it means that you want to remove as much, if not all, of the tumor without causing damage to that structure. Right. So there's a possibility that while you're operating, because the patient's losing function, you can't take out all of the tumor. So you'd have to leave some behind.
Sure.
There's a possibility that, you're getting pretty close to the speech area, and, swelling of the area around it might cause them to lose function in the that you're being monitored, whether it be moving of a limb or moving the face or moving our speech.
Right.
So those things can certainly happen.
Gotcha.
And of course, you're removing tissue, which means that if you touch them, they're going to bleed. So there's certainly those general risks are still there in terms of bleeding and infection. They're still there. But whatever you are trying to avoid can certainly occur.
Right.
And even if it doesn't occur immediately on the table, it can happen, a few hours after surgery.
Right.
Because swelling can happen. Hence the reason why we still have to, even when everything goes well during the operation, we still have to keep them under close observation afterwards to make sure no new complications or no complications are happening.
Gotcha. Understand. Now, earlier on we talked, well, first of all, again, congratulations. I think, we love it when a plan comes together, and you certainly, embody that saying. Want to know what comes next. Earlier at the opening, I asked the question, is there enough, for lack of a better word, business to keep professionals such as yourselves busy and active and current in terms of your medical qualifications? Your answer was yes, there is. In terms of your experience thus far, what are some of the more common brain-related conditions that exist in the Cayman Islands that might otherwise require the attention of skilled clinicians such as yourselves?
Well, certainly, we manage both brain and spine pathology. And spine, is a significant component of what we do here in the Cayman Islands.
Okay.
Back pain from disc prolapse, sciatica type problems, neck pain, pinched nerves in the neck, along the spine, tumors in the spine, tumors in the brain.
Yeah.
We have different types. You have types that occur from the lining of the brain, such as meningiomas, tumors that arise from the pituitary gland. They have too much water in the head, a term we call hydrocephalus, hydro water cephalus for head, and that can be causing buildup of fluid inside the brain. If you have had a bleed inside the brain, or even a stroke,
right.
Or head trauma. Those are common things that we see. Infections in the brain or in the spine. Those are other conditions that we see, and I'm talking about these that can present both electively, such as the non-emergent, to the emergency situations that they come in through the AR, and you pretty much see them start needing emergency surgery.
Right, right, indeed. To be able to perform a surgery of this caliber requires not only the professionals, but the technology to complete it. And for someone who grew up here, this is home for us. For me, I've seen healthcare improve from what I call the Flintstone era to maybe now the Star Trek era. And that's a good thing. What are some of the technological advancements that are available at the HSA now that make procedures like the one you just did, as well as the ones you just mentioned, possible? Number one, I want you to think about that. And Grace Boda, certainly for you to think about afterwards, what are some of the incoming medical technology improvements that make you most excited that maybe we can also add to our toolbox of resources here in the Cayman Islands? But first, talked about what is available technology-wise at the HSA. Dr. Cooke.
Well, certainly, neurosurgery is an expensive specialty. And by that, there are many, gimmicks out there, a lot of tools or equipments that we, can use. Fortunately for the HSA, we have a wide variety of equipments that's allowed us to do what we do on a daily basis. They've been able to acquire equipments from external sources to have available for whenever we have procedures. I mean, to get inside the head, we've moved from the days gone by where you'd use almost like a hand drill and a back and forth jiggly saw, we would call it,
Right.
to having specialized high-speed drill that we can actually make windows in the skull.
Wow.
We have, equipments to, that we use for basic stuff to operate on the brain, to, make us see better, to magnify. We have, because, you have to think of it. The brain is something that, it's microscopic most times. And you want to basically visualize things zoomed in.
Yes.
So that you can actually, see where the blood vessel is, where the tumor is, differentiate it from the brain. So that's important. We have equipments that can allow us to monitor pressures in the brain, and these are things that can be done after the surgery.
Yeah.
Or sometimes, if you want to check what the pressures inside, we can put those things in and have real-time assessment of what the pressure is like.
Right.
We have other equipments that are there that we can use to, stop bleeding.
Yes.
We have, and these are all, collaborative efforts between the anesthetist and the surgeon, because we do rely on the anesthetist to provide us help with, some of the, the gases that they give or some of the medications that they give,
Right.
which has to be delivered under, specific doses or slowly. They have pumps that can generate, give these at the required dose without having to physically, inject it.
Indeed. Well, obviously, the confidence booster is there for those persons listening in. We've come a long way, Cayman, but we certainly have arrived in terms of technology and expertise, and our guests in studios are an example and proof positive of that. With the waning moments left, I gave you the first word. I'm going to give you the last word, Nurse Grace. What are some of the emerging technologies that's on your Christmas list for the HSA?
So, neurosurgery has evolved, quite rapidly, actually. The techniques that we use and also the technology. So, one of the things that we discussed in terms of navigation surgery. All right. So, the equipment that we will be soon looking into is that getting a navigation. That means that it's just basically like a car, how you navigate the, what do you call that? GPS, yes. So it's kind of that kind of approach. So it would actually, direct you to the tumor, where the tumor is located. And so because, you do a lot of, process before the surgery itself. You register the patient, you do a certain type of CT scans and all of that. But inside the theater itself, you have certain equipment that it is going to be supporting you with that sort of approach. So we are thinking about that also, purchasing the new advanced microscope, which would help us in doing this. So which would be even actually, we can provide even better service for our patients. But I'm just saying that, so on this note, I just wanted to thank the whole support team and also my team as well for, not being scared of doing these sort of procedures. And so in future, we are more equipped with this sort of procedures. And just for the local healthcare and for the patient's benefit, I think we are confident that we can actually provide this sort of service for the patients. So they just have to ask the question when they're discussing with the surgeon about this, if they touch wood, if they don't have to come to this sort of, but if there is a need for them to come to this at this level, so they can ask the questions to see whether there is a possibility for them to go through this route.
Indeed.
All right.
Well, Nurse Boda, Dr. Cooke, I want to thank you both for being our guest on this episode. I am certainly much more confident, even increasingly more confident in the services and abilities and resources at the HSA than I was when this conversation started. I think that's the unique factor of this type of discussion, it allows our listening audience an opportunity to learn more about their health services authority. You know, it's no longer your mama's health services authority. We've come a long way, and it's a good thing. And we're performing procedures such as this. I want to thank our guests. I want to congratulate the HSA on the first ever Awake Brain Surgery. I see great things in their future, and certainly to our listening audience, we hope you have enjoyed today's episode and our discussion. And again, reminding you to tune in every Friday and Saturday at 1 p.m. to learn more about your healthcare today with the Health Services Authority. I'm your host, Austin Harris. Thank you for tuning in, and we'll look forward to continuing our conversation on the next Healthcare Today with the HSA, brought to you exclusively by Bobo FM.